Out there. Today is Saturday, 5 o'clock, and actually we're a bit late. Welcome to another session with Dr. Soliman, Your Health Today, My Media Prime. Today we'll be talking about something that really, we have talked about before, but we'll bring it back up because of a lot of demands and questions regarding infertility in women. And that's what we're going to be discussing today. So we will be talking a lot about infertility in women today. And I will share with you later on a couple of success stories of women that had tried different means and different institutes, and it didn't go through for years. Well, the solution is very simple. So today we're going to talk about, again, a big, quick revision on female infertility. What can cause infertility in a woman? I know it's an issue that touches a lot of you, and a lot of you are concerned about infertility, especially in women. When we talk about the woman anatomy, the woman reproductive system, the first thing we will have is the vagina. We talk about the first thing the sperm will meet is the vagina. That is the first station. For the sperm to survive, the vagina has to be suitable. Suitable meaning not a harsh environment. Not a harsh environment meaning the pH, or let's say the middle point, between alkalinity and acidity, has to be suitable for the sperm not to get injured, harmed, or killed. Why the vagina environment is very crucial for us? Because assume that we have a patient or we have a husband that has a low sperm count. When we're talking about sperm count, we're talking about 20 million above, all the way up to 350 million. That's a lot of sperms. But if we're talking about somebody with oligospermia, low count sperm, then those 20 million or maybe 18, 15 million is very vital to me. So I need to keep all those sperms healthy to make it all the way through the vagina. So let's talk about what can affect the vagina that can harm the sperms. Well, any woman that complains of itching, that's a warning sign. Itching in the vagina cannot be out of three categories, three things. Number one, if the woman have itching and whitish discharge, that is simple bacterial vaginosis. Meaning you can get it when you're stressed out, when your immune system drops down, you get bacterial vaginosis. When you take a heavy course of antibiotics, a week later you can get those whitish, thick discharge and vaginal itching. Under the microscope, we will not see any microbes. We will just see some clue cells, and this is our hallmark for those when we take a swab. We know this is a bacterial vaginosis, and before even the patient goes for the swab, we already know it's bacterial vaginosis, because when we check the discharge coming from this vagina, we'll find it is white and thick, and it can only be bacterial vaginosis. Can bacterial vaginosis harm the sperms? Yes, it can harm. Those thick charges coming around the vagina, this is not also a suitable environment for the sperm. So we need to be clear. We need to be clear. The vagina has to be very suitable to receive the sperm. Let's move forward. There's a second scenario. The second scenario is a bit more let's say harder than bacterial vaginosis. The color now will change to yellowish, whitish yellowish, and will have an odor, will have a bad smell in the vagina. Okay, and this we call trichomoniasis. Okay, trichomoniasis, however you want to call it, but this is a sexually transmitted disease. Anytime we say sexually transmitted disease, that means both sides, both sexual partners must be treated. There is no way out of this. If I treat the female and I do not treat the male, most likely when they have another sexual encounter, they will contract that Trichomonas. Trichomonas is a motile protozoa that can be sexually transmitted and is the one responsible for this odor and the yellowish whitish discharge. And also it can create unsuitable environment for the sperm, especially for those who have low sperm count. So we discussed two cases now. We discussed two things about we're still at the vagina level. So we discussed two things. One of them is the bacterial vaginosis. The second one is trichomoniasis. So now, what is the third one? Candidiasis. Candidiasis. How can I differentiate between the three without even going to the lab? You can even know which one you have yourself if you just follow and understand how each one presents. Candidiasis, the vagina is tomatoes red, is strawberry red, is very red. You open the labia, you can see very red color. That is a sign of very bad inflammation. Candidiasis is bad. You cannot, let's say, afford to have anybody touch. You cannot have an intercourse because it's burning. It is very burning. And if you look at the color is very red. That is candidiasis. If I want to be sure, I'll just take a small swab, sent to the lab, and I will see my evidence for candida, which is a fungi, a kind of fungi. You can see the hyphae, you can see the spores, you can see all evidence of fungi. So those are three conditions that can be problematic for the sperms when the sperms enter. Right? They can be problematic for the sperms when the sperms enter, meaning they could be harmful for the sperms, especially if we have a male with low sperm count. What will be the second stage? After we pass from the vagina and assuming that everything is okay, none of those three conditions exist, you know, we move on to the cervix. That is the mouth. That is the opening, the first opening for the uterus. The uterus is like a spheric shape and it has a mouth, and this mouth is inside the vagina, in the upper third in the vagina, deep inside the vagina. We have an opening that is the followed by a canal. We call it the cervical canal, and that lead to another cavity which we call the uterus. This is where the baby will stay, inshallah, when you get pregnant. Now, the cervix can also have small problems. You know, we can have cervical stenosis, meaning the cervix opening is very narrow and the canal is very narrow because of some fibrosis that has taken place there. You know, maybe you went for abortion, maybe they scrub it too hard, maybe they injured it, it became fibrotic, it became scarring. Now, if the stenosis is too bad, it's very easy to know that you have a stenosis because your menses will not be able to drop down again. So once the menses, because the menses has to go through the cervical canal. So if the menses is not there anymore, you know for sure that there's something wrong with the cervix. I need to be checked. But what else can block the passage in that cervical canal? Any polyps that can grow to outside the cervix and cover the mouth of the uterus, so nothing can go. Nothing can go. It's like a one-way valve. Nothing can go in, but the menses can come out. So menses can come out by means of gravity, but the sperms cannot go in because this polyps will cover the mouth of the uterus, and no sperms can make it to the cervical canal, and as a result, that's another form of infertility, another cause of infertility. So what else with the cervix? The cervix could be inflamed. The cervix could be very inflamed, and the reason for inflammation of the cervix is something that is very common. We call chlamydia. Chlamydia is enemy number one for fertility. If you want to have a baby, the enemy number one to you is chlamydia. You have to be sure you do not have chlamydia. Let's take, if possible, we take 1 minute break, and then we'll continue what you need to know about infertility. In summary, the pinpoints.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at Mile 18 Bomaka. In Vola, you can find us at Bonneberry, precisely at Entrée Pilote. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome back. So we talked about the cervix, and we talked about enemy number 1 for fertility, for having a baby, is chlamydia. Why enemy number 1? Because that is the most common. So a disease that is most common, that will make it number 1 enemy, and that is chlamydia. Chlamydia most of the times is asymptomatic. Asymptomatic meaning you do not feel it, especially in a woman, you don't feel it. When it becomes too much, okay, and then you will have, in a woman, you will have what is called pain during or immediately after sexual intercourse. Anything that touches the cervix in a woman, in this case, the woman will have pain. We call it cervical motion tenderness. You touch the cervix, the woman will jump, the woman will feel the pain. So this is on clinical examination, on vaginal examination. Even you at home, when you have sex and you see that you're having pain, most likely you're having chlamydia. So you should be checked for chlamydia immediately if you think there is pain during or immediately after sexual intercourse. Why is that? Because chlamydia causes cervicitis. Cervicitis meaning inflammation of that cervix. Cervix, cervicitis, anything that ends with itis, that means inflammation of that specific place. So we have inflammation of the cervix. So what does that mean? Well, when things get inflamed, they get swelled. And when things get swelled, especially, you know, if you have cervicitis, for example, that means the canal, the cervical canal, is not functioning very well. And when things get swelled, that canal diameter, the diameter of that canal will definitely get less. So that is less chance for the sperm to pass. What else in that cervix? We have mucus. We have mucus. Normally, you know, during the month, okay, especially in a phase that is before ovulation, the mucus is very much thick. Thick meaning, you know, like a mucus plugs. Thick meaning it cannot allow anything from the vagina to ascend, to go up. Especially we have normal flora in the vagina. Vagina is just like the mouth. The same, very much the same flora of the mouth is the same flora that you can find in the vagina. They're very much the same. So now, when we have this bacteria, flora meaning bacteria, good bacteria that has to be there. So if it ascends up to the uterus that is supposed to be sterile, that will give us problems. So in order for us to protect the uterus, we'll have to have those thick mucus plugs to prevent anything from the vagina to ascend up. So then the question would be, how then would the sperm go up and penetrate that thick mucus, makes it all the way to the uterus, if what you say is correct? Well, yes, I am correct, and this is exactly the scenario. It's just that for a simple alteration of that mucus during ovulation, the mucus becomes very thin and watery. So when it becomes very thin and watery, the sperms then can pass. The sperms then can pass. So those are the problems that are, you know, unique to the cervix. So we can also have internal polyp, and when we have internal polyp, that will also limit the movement of the sperms through the cervical canal to the uterus, and that also creates us a small problem. So we have to be sure the cervical canal is patent, is nothing in the way to block the passage of the sperms into the uterus. We have to make also sure the mucus get liquefied and becomes like water during ovulation so the sperm can pass. This is very much the most important things about the cervix. And we said enemy number 1 is chlamydia. So chlamydia can cause inflammation of that cervix, but this is not the only thing chlamydia can do. Chlamydia is very bad, even though it's a very easy to treat disease, but it can also go to the tubes, go to the fallopian tubes, and cause very bad damage that is irreversible. Which is that damage? This damage is internal adhesion. It causes what is looks like a spider web, but is inside the tube. And this tube, if you remember, is one cell thick. That is not so thick, it's very thin. And inside that very thin tube, we have a spider net, like we call it internal adhesions. And that, of course, clogs up the tubes, especially if it's very thin. If the tubes get clogged up by what is this spider net or internal adhesion, we cannot fix it. There is no laparoscope to fix it. There is nothing you can fix it, because how are you going to deal with something that thin and that delicate? You cannot. We can only do external adhesion if you have, let's say, an old surgery and some of the blood was left in, and then it causes what is like web, spider web. Then we can cut them off and lyse them and do. But if the adhesions are inside the fallopian tube, it's very much difficult to deal with, and that would be infertility. So that is two things those small chlamydia has caused you, and that is very painful to know that such a small thing, such a small bacteria, intracellular bacteria actually, can cause all this damage, and we can easily prevent the transmission of chlamydia from one to another by just taking the test and make sure the sexual circuit stay close to those who are not infected. So, the treatment is very easy. The treatment is very easy. So, one thing to add, chlamydia never comes in by itself. It always brings her friends with her, like gonorrhea, like other aerobes, anaerobes. You get a multi-microbial infection. That is why it is very wise when we treat, we don't treat only chlamydia. We treat multi-microbial, because everything is there. Why everything is there? Because the cervicitis that has been caused by the chlamydia, we have a very delicate tissue now that is vulnerable to a lot of microbes. So we have to treat as multimicrobial, meaning not only chlamydia. We're going to move on to the next part, which is the uterus. The uterus is just a cavity that the sperms passes through, but don't forget, the uterus helps the sperm by some kind of movement to make the sperms move forward. Again, the same talking, like this, the uterus has to be clean. So what is the problem that we can find in the uterus that prevent you from getting pregnant? Well, the problem is something called myomas or fibromas. There are two types of fibromas. The ones that grow from outside the surface of the uterus, that is no harm, is no big deal. It will not affect. The only one that we really care about is the one that grows within the wall of the uterus. Imagine, the uterus is like a balloon. When the pregnancy is inside, the pregnancy is supposed to expand. As age advances, the balloon or the uterus now is very flexible, and it goes bigger and bigger and bigger and bigger. Now, if you have something inside the wall of that uterus, and the fibroma is a ball, very solid ball of very tough material, okay, that cannot grow, is not flexible. So you're going to have a defect in that area. If that fibroma happened to be very close to the endometrium or the cavity where the baby stays, then that, flexibility, that ballooning out to accommodate the growing baby will not be happening. So as a result, you may subject to spontaneous abortion. You'll drop the baby. Miscarriage, you will drop the baby. So yes, depending on the size also of the fibroma or myoma, and the proximity to the endometrium will determine what kind of risk this patient is at for losing the pregnancy. So now the second thing we say about the uterus, remember I said it in one of my sessions before, when you have a multiple sexual partners, if you are a female and you have a multiple sexual partners at the same time, that is no good. And we explained why that is no good. Because, we have what is called memory cells. Memory cells is not only in your brain. There are memory cells in the heart. And there are also recently found that there are memory cells inside the uterus. The funny thing is that uterus that you think is only for babies, it has memory cells that remember the fingerprint of each sperm. Meaning if you have a husband, that uterus will remember the sperms of your man. Now, if you go out there and get another sperm, that uterus will recognize that this sperm does not belong to this uterus. The uterus does not recognize, so it has a memory cell. So what is the disadvantage here? When you have multiple sexual partners and each one of them ejaculate, now the uterus is confused because he only know one set of sperm. He get used to one set of sperms, and this the fingerprint that he has. The others he doesn't recognize. So when you confuse the uterus fire back at you by developing a lot of myomas, developing a lot of diseases that we know, and some of the diseases we don't even know because we didn't even discover. So that is one thing that we have to keep in mind. The uterus also have a memory cell. Multiple sexual partners is not good because that can induce a lot of diseases, among which myomas and fibromas. You know, it doesn't mean that if I have a myoma and fibroma, I have a multiple sexual partners, but I say it puts you at risk for having myomas and fibromas, okay? Let's take another 1 minute break and we continue. Thank you very much.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Nsah just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonneberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Problems, uterine problems. Now let's move on to a different structure, which is the fallopian tubes. What could be wrong with the fallopian tubes? We said already one thing, which is chlamydia. Chlamydia can cause internal adhesion. Blockage of those tubes basically is secondary to chronic chlamydia that has been taken care of for a very long time. So that is blockage of the tubes. Okay, and that can lead to infertility, making chlamydia enemy number 1 to you if you want to have a baby. Now, the ovaries. Can we have a problem on the ovaries? Yes, we can have a couple of diseases. Most commonly, the one that stands against fertility and you having a baby is something called PCO, polycystic ovarian disease. Polycystic ovarian disease is manageable and you still can have a baby unless the PCO is combined with virilization. A lot of girls come, a lot of women come to me and say, the doctor has diagnosed me with PCO. We look at the uterus. It is not really a complication. So the woman is worried so much she cannot get pregnant. This is not a complication. PCO, unless it's combined with something called virilization, it's a problem. It might represent a problem. But even with that, we can, you know, most doctors, specialists, they can take care of that scenario. But what is the problem here? You know, what is virilization? Virilization, when you have androgen or hormonal, it changes in your body to the extreme point that now you have hair in your face, you have hair in your chest, your body is very much hairy, and that is virilization. Not only that, not only the hair, male distribution, hair distribution style, no, but we're talking about voice changes. Your voice becomes like a man voice, and that is a problem. That is a problem. That's what we call virilization. And it is degrees. We have mild, moderate, and severe. Okay? So if you have the severe form, then the treatment will take a lot longer than if you have just you know, multiple few cysts here and there in the ovaries without virilization. So that is the problem with the ovaries that can stand against fertility or having a baby. So now, so that is the structural abnormalities that we can find a problem when having a baby, when getting pregnant. But beside that, there is also another problem that can stand against fertility and having a baby. Which what? Hormones. Hormones. Let's play the first video. This is one of our success stories of a lady who visited me 4 months ago, and we did the ultrasound a couple of weeks ago, and she is pregnant. Can we please, if it's possible, we'll play that very first video. This is the pregnancy sac right here, and this circle here, that is, okay? Tell me, madam. Tell me your story now. You came, when did you come here before the first visit?
The first visit was around June. So I came here, I had a problem of...
That's 4 months ago.
Yes, 4 months ago.
Yes.
I had a problem of infertility. I've been struggling to take in, but it wasn't easy for me to take in. So
have you been to other places before coming here?
Yes, I've been to many places.
Many places.
But I did not get a better explanation until when I came here before. The
Right.
doctor told me that I had a problem with my high prolactin.
Yes.
So he started giving me treatment, and I followed up every bit of his treatment for 3 months, and finally I became pregnant.
Yes, you tested pregnancy test at home once, and you went to the hospital to confirm, and it was positive, and then you came to me today, and now we further confirm that the pregnancy is inside the uterus. This is the pregnancy sac right here, and this circle here, that is the fetal pole. That means this is a valid pregnancy inside the uterus. The treatment took about 3 months, right? 3-month treatment, and the 4th month she is already pregnant, right? We thank God for that. That, you know, and then let's just gonna move forward a little bit, and then we're gonna measure this pregnancy, and we see, let's see the gestational age, early pregnancy, and the gestational sac. Yes. Okay, well, please, I can take the text. I mean, this number has WhatsApp, so please, if you have questions, concerns, text me, and I will be more than happy to answer you. I see a lot of calls coming in. Okay, see, what is the problem with this lady? The lady came to me 4 months ago. Okay, she been to different places, she done a lot of tests, but it's nothing. For the last 2 years, she say or so, she been to a lot of places, but nothing. She cannot take in. So she came to me, we ran the infectious profile, and there is one thing a lot of people forget. The hormonal profile is very important. It's very easy, really. You can do the same thing at home, and I'm gonna teach you what to do. If you squeeze your breast hard enough, I know it's a bit painful maybe, but squeeze the breast hard enough and let any secretion out of the nipples. If you get discharge from the nipple, milky discharge, you know you have a problem with prolactin. Prolactin is a hormone coming from a gland in the brain called pituitary gland. Okay? So now if you get the milky discharge from that breast, you know that prolactin is high. And let me talk about prolactin for just 1 minute. Prolactin coming from the pituitary gland, when it's too much, that means we have an adenoma. We have a tumor inside that pituitary gland causing the prolactin to be high in secretion. That tumor could be very small, and as a result, the prolactin will be not as high. Or the tumor could be very big, and that prolactin will be very high. And when the tumor is big, it pushes against the chiasm of the eye in the back of your eyes, and you feel pain in your eyes. If I touch your eyes like this, it's very hard and it's very painful. The pain is right here. That means there is an adenoma, big tumor growing in the pituitary gland in your head. So how high the prolactin level very much correlate to the size of that adenoma. Now, pregnant women after they put to bed, they breastfeed. And that milk that comes out of the breast, who is responsible for it? The prolactin that is coming from the pituitary gland. So if the pituitary gland continues to secrete prolactin, you will continue to secrete milk or milky discharge from the breast. So if you see a feeding mother, can she get pregnant? She cannot get pregnant. Why? Because she is feeding. That means prolactin is high, and that's why the milk is coming out. So you cannot get pregnant when the prolactin is high, leading to milky discharge from the breast. Just to add one small point. Can men have high prolactin? Absolutely. And I seen a case with a tumor, with a big adenoma that is pushing against the chiasm of the eye, and the guy, severe headache. And the answer was, the suspicion was prolactinoma that has been confirmed with a CT scan. So, but can the man also, if he has prolactin, can he secrete milk from his breast? The answer is no, because the structure of the breast of the man is not the same like the one of the woman. What is missing there? A hormone, another hormone called estrogen. So it's the combination, the presence of estrogen, that makes the discharge come out. You understand? Men don't have estrogen like women. So since the woman is the one having the estrogen, increase in prolactin will make her breast secrete milk. And that was the case with this woman. That was the case with this woman. She came in, everything is normal, because nobody ever has checked her prolactin. So when we checked that prolactin, it was high. We gave the appropriate treatment, the prolactin dropped, boom, she got pregnant. I do not just do that. We have to put the woman in what we call a protocol, like it's not actually stimulation. A lot of people use stimulation for the ovaries with a drug called Clomid. I don't want to say names, but anyway, this drug has a very bad side effect, because it can make the ovaries multicystic and form a lot of cysts. When we form cysts in the ovaries, that is a space. You know, if a cyst is a space, okay, full of fluid. Now, think with me for 1 second here. You're very smart, and you understand what I'm talking about. When we have the cyst ballooning out, getting bigger, what am I compressing against? The tissue, the meat of the ovaries, right? Okay, good. So when I compress against the meat of the ovaries, when I compress against those tissue of the ovaries, I am compressing and pushing it in and pushing it in. I will lose the function of that ovary. So when I use Clomid without supervision of a doctor, those multiple cysts, big cysts, will push against the ovaries tissue, and I have a big chance to lose those ovaries. So I don't like to use Clomid. As long as you're ovulating, you have your menses every month. You're ovulating. So why would I need Clomid for? If I know the side effects are huge. So I can use it, moderate doses, under supervision. I stop it immediately if I see any cyst formation. Now, I don't use Clomid. I inhibit the ovaries for 3 months. I sensitize the ovaries for 3 months. And then I release the inhibition. I stop the inhibition. At this moment, the ovaries are very much starving for sperms. I'll give you an example. If you do not put salt in your food for the next 3 months, no more salt. You take your food with salt or Maggi, and now as of tomorrow, you stop the salt, you stop the Maggi, and you eat the food. The food will sound horrible because you're not used to food without salt. Day after day, you will get used to it. A month later, you can only eat food without salt because you are so much used to that. 3 months later, this is what you're used to, food without salt. What if 3 months and 1 day, I add a pinch of salt to your food? What would you feel? Wow, it tastes horrible. You will feel the salt taste immediately. And that is exactly what I'm doing. So if we starve the ovaries for 3 months, then suddenly we release the sperms, the woman will catch. This is not the only success stories. We have actually a lady that has put to bed, yes, a couple of days ago. Okay, I do not deliver in my clinic, but I'll just take care of the pregnancy and will be more than happy. Simple methods to get you pregnant. Now let's see another video, and that's 37 weeks and some days pregnant lady. We've been following her for some times, and she also had a problem with having a baby. And actually, let's please, if it's possible, we can play the second video if you have it. It will be great. Recording from here? So record this screen. So, or you can record her stomach, it's fine, but no face. Okay? All right, so tell us now about this baby. How did you get this baby? How did you get there? That's not a question, right? No, yeah, this is the baby's head. Actually, we're taking a cross section in the baby's brain, and actually, you know, we started working on her some time ago, no? Yeah. And then, alhamdulillah, now you're pregnant, right? Mm-hmm. And the baby is about to come out. Yes. No? Yes. So why don't you tell us here, how did Dr. Soliman help you now? Huh? How did Dr. Soliman help you? Tell me now.
You know, I know what to do. I went to do it. It's a lot. You helped me a lot. Thank you. I'm so happy.
Well, gestational age where your BBD is about 37 weeks, 4 days, huh? You're about to give up. It's about to come out.
37.
57 weeks, 4 days.
Ah.
Let me do another measurement also. Okay, so now this is the baby's shoulder. He's giving us his back. Or what did I tell you the sex was the last time?
Male.
A male, right? So now we're gonna do the heart rate. This is the heart right there, right? This is the heart right there. Yeah, that was nice. Okay, that was very nice. So we see in the video, okay, and I wanted to share something else with you, but it seems like my time is out. I was a bit late with the traffic today. We'll make it up next week. I promise we'll be on time, inshallah. But nevertheless, that will come up to end of our discussion today about women infertility. To take 1 minute about male infertility, we don't have much problems with male, except the male only provide the sperms. So the sperms could be either low in number or low in function. This is the only two possibilities we have about the sperm. What makes the sperm low in number? The testes have to be affected, because this is where the sperms are made, in the testes. So what will make them bad in function? Well, we have some infection that reduce the motility and, you know, mess up the sperms. So what is the first initial step in a man to evaluate a man? We have to do a spermogram. But keep in mind, the spermogram cannot be done when you haven't had sex for a month. The spermogram has to be done 4 days immediately after having sex. So this is the right time when I can make a spermogram, 4 days after having sex. Now, what is the function of the sperm? I said the sperm have to be very high in numbers, in millions, minimum 20 millions up to 350 millions or so. Why so high numbers? Because we lose so much of them during the process of getting to the ovaries. So I like to always give this advice. If you have a low sperm count, let me advise you, 2 pieces of garlic, raw garlic, you smash them very well. You smash them very well. You add them to 1 cup of yogurt. You mix them. You let them sit for an hour or 2, and then you drink every evening before you go to bed. Whatever time you want, it doesn't matter. Whatever time you want, as long as you remember you take it every day. That is beside. If you have a problem, we'll discuss the male infertility issues, but this is just a quick tip for you. So when you come and see me next time, the sperms will be high enough for you to have a baby. Now again, like I said, enemy number one for infertility for women is chlamydia. The same thing for men. Enemy number one is chlamydia. So once we take care of all infectious causes, then we can move on to stimulation and have good, healthy, large number of sperms. This is one of the things. But we cannot really develop the number of sperms in the presence of infection, because infection is a killer of the sperms. So you have to clear the infection, then work on increasing the number for the sperms. Thank you very much and have a beautiful evening. And I will see you next Saturday, 5. This is My Media Prime, live with Dr. Soliman, Your Health Today. You have a blessed weekend, and I will see you next week, Saturday, 5 p.m. Stay tuned. Thank you.